Hi, excuse me, starting off really well so far. Today is July 22nd, 2014, and today is my 1 year anniversary on Tecfidera. Yay me! Um, I was singing, my last video was a couple days ago, and somebody had asked me if I thought my flare-up was because I was on Tecfidera, and at the time I thought, yeah, maybe my flare-up was because I switched to Tecfidera. And I was thinking about it, and now I'm thinking maybe my flare-up was going to happen no matter what. My flare-up was in April, and when I had my MRI before I started Tecfidera, there was no new lesion. What if Tecfidera actually stopped other lesions from forming? What if there was actually going to be more lesions or whatever? What if my flare-up would have been worse? And Tecfidera actually made it not as bad as it would have been. I'm, just starting to really come out on the other side of this flare-up that I had, and I mean, nobody knows. It's quite possible, like I said, the flare-up could have been worse. Maybe there were more lesions that were going to be created or should have been created, and Tecfidera kind of like did a kung fu chop on it or something, I don't know, and made it so it wasn't as bad, or I didn't have as many lesions. I don't know if that's the case or wishful thinking or, shit I'm just making up in my head, but I don't know. I'm not going to, go back on Copaxone or Rebif. I'm going to stay on Tecfidera. And I guess the only way to find out if this is the right drug is to just continue taking it and see what happens. As long as I don't get any other new lesions, and hopefully, cross my fingers, not another flare-up, then, what else can I do except stay on Tecfidera? The beginning was really hard. The flushing was just uncomfortable and the rash, and then after, I switched to 240 milligrams, the nausea and the horrible stomach pain was just, made me want to stop, but I'm so glad I didn't. I don't ever want to have to stick myself with, do an injection every other day with Rebif or every other day with Copaxone. It's completely ruined my hips, my thighs, my stomach. They're just tore up. So much scar tissue. I no longer have welts, bruising, all of that other stuff. I'm pretty happy. I'm happy on Tecfidera. I'm happy with the results. Unhappy or disappointed about the flare-up, but happy that it wasn't as, it could have been worse, I guess. I'm not really sure, but I'm just, I'm grateful for Tecfidera. I'm grateful that there's now oral medications out there that we can take, and, while they're still relatively new, who knows? I mean, all of these drugs were relatively new at one time, right? Yeah. And I don't know. It's just 1 year on Tecfidera. Really happy with it. I'm gonna stay on it, and that's about it. I don't really have a whole lot to say. I was just thinking, about if it could have been worse. I don't know. Bye.